Let's discuss the role of ultrasound in managing fibroids during pregnancy. And what are fibroids? These are just non-cancerous growth which are found in the muscles of the uterus or around the uterus or in the pelvic region. And once you're pregnant, when you do the scan, sometimes you'll find out that you have fibroids, and maybe you did not know that you had fibroids. And why is an ultrasound scan so important when you have these fibroids? One is that we just want to look at the size of the fibroids, and we want to look at the location. The size is very important because if they are very big fibroids, we want to know if they are going to affect in any way the way you are going to deliver your child. Once again, we want to look at the location. The location again is very vital because we want to make sure that these fibroids are not low-lying. Low-lying fibroids means that they are in the lower uterine segment and they are covering the internal cervical os. And if they are covering the internal cervical os, then it becomes tricky. It becomes tricky when you're giving birth, because sometimes they always obstruct the way out for the baby. So once we find the size and we look at the location, then we'll have to communicate this information with the medical team, with the clinicians who are attending to you at the clinic, so that at least they can plan as fast as possible, they can plan as early as possible the way they are going to help you to have your baby safely after 40 weeks. So once you are pregnant, if you're told to do a scan, kindly do it, because once we find that some of these things are there, once we find that they're fibroids, we want to look at them just to make sure that we want to look at the size, we want to look at the vascularity, we want to look at the location, and we just want to make sure that even after having the pregnancy, after the period of 9 months, the fibroids are in no way going to affect the way you are going to have your baby or the way you're going to deliver. So thank you very much for tuning in. That's what I wanted to discuss today, and I think once you're told to do a scan, I've said it's a simple procedure. Just kindly go ahead and do it, because the information that we get from the scan can be very useful for us, helping us to have a normal pregnancy. And if you have fibroids, there's treatment for this. There's always a solution for this. And my prayer has always been that you shall be well. And after 9 months, you will have a normal baby, and we are all going to celebrate. Thank you for always tuning in. Have a great day ahead.